DJ and bar owner Javier Cruz is excited at the prospect of reopening his listening bar in Bogota. Waiting much longer could be the end of the road for his business, as it has been for many others.
We are full of hope now, but we must do this with great caution and awareness, keeping many safety precautions in place because we are still in a critical moment and we need to take care of each other.
That's what the government hopes most Colombians will do, as it bets on reactivating all sectors of the economy to try to respond to growing poverty and unemployment, despite being in the midst of the worst peak of the pandemic. More than 500 Colombians are dying every day, record numbers of infections are being broken, and intensive care units are at capacity in all major cities. Even field hospitals set up to ease pressure on the system are full.
We've been at a very high plateau for many weeks, waiting for a reduction, but instead the figures keep climbing for both infections and deaths. We're seeing major clusters due to the social situation in the country, so things could get even worse because the numbers show an exponential increase.
Much of the blame for the stubbornness of this surge is focused on the ongoing anti-government protests. Authorities are using them to explain the paradox of opening up right when conditions are at their worst.
We could stay at home in strict quarantine throughout the city, but the infections have already occurred. With or without opening, we will have 2 to 3 weeks with high occupancy.
The government is confident that a faster pace of vaccinations will help improve the health situation in the country in coming weeks, but a number of doctors' associations say that the decision to reopen now is reckless.
The government's decision isn't based on science. Many doctors and academics have been studying the decree, and we can't find validity to their arguments. That's why we're asking for it to be repealed. It's a paradox. We're pushing our society towards an even worse tragedy than the ones we're already living.
Concerts and dance clubs will remain closed until ICU's occupancy falls under 85%. The rest of the restrictions are now gone, with Colombians left wondering if they will be able to strike a balance between the need to work and the need to save lives. Alessandro Rampietti, Al Jazeera, Bogota.